Hello, my name is Justin Griffin. I'm going to be your family nurse practitioner student today. I'm going to be doing a health exam on you. Do I have your permission to put this on YouTube
Yes,
and for my teacher to grade?
yes,
And are you comfortable before we begin?
yes.
All right. Can you tell us what's your name,
Katrina Griffin,
what's your date of birth,
5/16/86.
what race are you,
I'm African American.
and what sex are you?
I'm a female.
And how do you most want to be? What do you want to be called?
Katrina.
Good. Do you have any allergy? What brings you in today?
Physical wellness.
A wellness exam? Anything else bothering you?
My thumb hurts.
Your right thumb?
Yes.
Yes. How long has that been hurting you?
Off and on, 2 years.
Um, for 2 years, does it come and go? Is it constant?
It happens from swiping too much or typing.
Swiping like your phone?
Yeah, from swiping my phone. So I got off social media. That helped. If I go to work and I'm typing, and I type too much or text it too much, then I do have pain at the end of the day. It's very uncomfortable.
Can you describe the pain to me?
It's like dull on a regular basis, but at the end of the workday, it'll be sharp.
Okay, so dull, and it's because overuse it becomes more sharp.
Yeah, if definitely not using it
Okay.
makes it better, but if I use it a lot, then it hurts a lot.
Okay, so using it aggravates it, whereas not using it relieves the pain.
Yeah, pretty much.
Yeah. And is there a certain amount of time that you use it that you notice that it hurts more?
It's hard to tell.
It's hard to tell.
I just know if it hurts, I've been on my phone too much, texting or typing.
All right, and then on a severity range, on a pain of 1 to 10, how bad's the pain if you're not using it?
Like a 2.
And how bad's the pain if you are using it?
Like an 8.
Okay. Do you take anything for it?
No.
Okay. Do you have any allergies?
Yeah.
What are your allergies?
I mean, like the food?
I mean, in general, there are food allergies you can have, there are environmental allergies that you can have,
Well,
there are medication allergies that you can have.
So environmental, I'm allergic to pollen during springtime. Food, avocados, the skin of peaches. I think that's it. And then
Anything like latex?
oh yeah, yeah, I do have latex allergy.
You have latex. What about medications?
A specific brand of vitamin C tablets.
Okay. And this is going to be kind of difficult. We're going to kind of track through, but what happens when you have these allergy outbursts? Do you have hives? Does your throat close up?
With the pollen, I just sneeze and have runny nose. My eyes will itch. Latex breaks me out. Well, latex, avocado, and avocados break me out in a rash. And peaches make my mouth itch. And sometimes I break out in hives on my lips.
Okay. Do you take anything for these?
Oh, Zyrtec for the pollen.
And how often?
I'm allergic to cats too.
Okay, so cats as well.
Same reaction as pollen. So if it's the season, like pollen season, I take Zyrtec. If I'm going to be around a cat, like if a friend of mine has a cat, I will take a Zyrtec before I go, but I don't take it every day.
You said that was. Did you say how many milligrams it was?
No, like 10.
Yeah.
However it comes.
10 milligrams.
Just one tablet.
Take that PRN. Do you take any Benadryl or anything like that for it?
No, Benadryl makes you sleepy.
Okay, but Zyrtec doesn't?
No.
That's good. Have you ever been hospitalized for any allergies?
No.
No. Good.
Oh, excuse me.
Are you up to date? It's okay. We're all very busy. Are all your immunizations up to date?
Yeah.
Yes. So all of them. Have you had the flu shot this year?
Yes, but no, I need it right now in a month or so. I'm gonna get it.
Yeah. It's just about time. It's
Just
starting to.
I got it
We're
last
starting to
year.
see some flus come down here. And then, what about your Tdap shot? Are you current with your Tdap?
Oh yeah, I've been pregnant like 3 out of the last 5 years, and I get a Tdap every time I'm pregnant.
Good. Wonderful. Do you take any daily medications?
No.
Not at all?
No.
Oh, good. Do you take over the counter
Just has
medications?
Zyrtec,
Just the Zyrtec?
maybe ibuprofen if I ever have a headache, but that's it.
Okay. Do you have any past medical history such as asthma, diabetes, hypertension?
I had childhood asthma.
When did that start?
I don't know, when I was a kid.
Okay, so very young. Do you ever get hospitalized for it?
No.
Did you take your inhaler for it?
I mean, when it was exercise induced, I had used it like as a teenager.
Okay, but since then you hadn't had to use it.
No.
When was the last time you used it? A long time ago. Got it. Do you have any surgeries?
No.
So no. No. You mentioned you had kids. No C-sections or anything like that.
No, they're all natural or vaginal births.
Oh, good.
Yes.
And you had how many kids do you have?
3.
3. Um, did you have any miscarriages?
No.
They're all living?
Yeah.
All right. Right. How is your family history? Like, how is your mom's health?
Oh, she's she's almost 60. She's like 62. She'll be 63.
Oh, good. living,
Um,
living strong. Does she have any diabetes,
she has
hypertension?
she has diabetes and she's obese.
Okay.
I don't think
Any
anything else is.
COPD? Does she smoke? Does she
No,
drink?
she never smoked.
Does she use any illicit drugs?
No.
No. How about your dad? How's his health?
Fine.
How old is your dad?
64.
Don't go tell
Mm.
him. Does he have any medical history?
I mean, no, not really.
Not really. Good.
He smoked.
He did smoke.
Yeah.
Do you know how many years?
Oh my gosh. Since I've been alive, probably 30
And
some years.
what did they do for work?
My dad was in the military and he was a sheriff, deputy, and my mom's a social worker.
Oh, good. What about your mom's mom?
My Meemaw, what did she do? I think she did housekeeping and
Housekeeping,
she
and what was
delivered
her health?
babies. Huh?
I said, and how was her health?
She's a pretty big woman. She's large.
So obese.
Oh yeah, but she didn't really have that many health issues. Now she had dementia towards the end.
Yeah. You said towards the end, so I'm assuming she's deceased.
Yeah, she passed away when she was 89.
Okay. Of what?
I'm not sure. I just know she was in the hospital for, I think, a UTI, and then she ended up getting a ulcer on her bottom, and then it got infected, and then she just didn't do well after that.
I'm sorry to hear that. So then we brings us to your mom's dad.
I never met him. He died like when he was 50 or late 40s, early 50s of a heart attack.
Of a heart attack.
Mm-hmm.
Okay. What about your dad's mom?
She passed away when I was like 4, so she might have been in her 60s or 50s of lung cancer.
Lung cancer. Okay. Family history of cancer. What about your dad's dad? How's his health?
He's real good. He's 93 years old.
So he's still living.
Yeah, he walks on his own. He's very sharp. I think he has throat cancer.
Oh, so possibility of another cancer.
I'm not sure. He's got something in his throat that makes it hard for him to swallow.
Okay.
And that they're not going to do anything about because he's 93.
That makes a lot of sense.
Yeah.
Do you have any brothers or sisters?
Yes.
And are they healthy?
Yeah, they don't have any issues.
And what do they do?
My older brother is a computer IT person, and my sister is a licensed social worker.
Okay. And family's good? Like no issues with the family?
Yeah.
No? Okay, good. Everyone gets along well. Now, how is your diet and exercise?
Well, I was exercising every day until about a year ago.
And what happened?
I got a job, and I don't have time to exercise.
Yes. Jobs take up a lot of time.
I really focus on my eating. I make sure that I eat well.
Well, good. What's your eating look like?
I just try to eat fresh fruits and vegetables. I try to cook my own meals. I don't really try to do processed stuff. I try to limit my amount of sugar, although I do have sweet things. I try not to eat too many carbs, like bread. Um,
It's a very good, healthy diet. Good. What
and I
about?
can't stand fast food except for Chick-fil-A.
That's excellent. Fast food is bad for you all around. What about caffeine intake? Have a lot of
Um,
caffeine?
yeah, I'll have like a Starbucks drink, but I'll make sure it's half calf,
Okay.
like half the
Well, good.
caffeine, and because caffeine really affects me, so I try not to drink as much. But
Affects you how?
it just makes it hard for me. If I have a whole cup of coffee, it makes it very hard for me to sleep by the end of the night.
Okay, so it almost gives you a little bit of insomnia.
Something like that.
Okay. What about tobacco use?
I don't smoke.
You don't smoke? What about illicit drugs, street drugs?
I don't do street drugs either.
I know, it's a funny question. What about alcohol?
I have a glass of wine maybe 2 or 3 times a week, if that.
Okay. So 2 to 3 times
Just
a
one
week.
glass.
Why'd you say it like
I
that?
can't do more than 2.
Okay. Do you have other people around you that drink and smoke or use drugs? Like friends or family?
I mean, not really, not around me all the time. We all have that family member.
Yeah.
That
But
does
no
stuff.
one in the house?
Oh, no. I don't allow smoking in my house.
Oh, good. Then we'll move right on. What about reproductive system? So when was your last menstrual period?
The beginning of August.
Okay. Any chance you're pregnant?
I don't know. I shouldn't be.
Why do you say that?
Well, I'm not on birth control, but I have sex.
Unprotected sex?
Correct.
With who?
My husband.
Good.
Justin Griffin.
You have a husband. Good. How long have y'all been married?
7 years.
Lost my train. What's your current living situation?
I live with Justin and my 3 kids, and we have somebody that lives in our upstairs.
I'm sorry. Let's go back to the sexual orientation. So you
Justin is a man, and he was born a man.
yes.
I like men.
Good. And then do you have any STD history?
No.
Okay, good. So everything's down there. Anything downstairs off? Like does it smell? Are you having a discharge?
No, I'm all good there.
You're all good down there. Okay, good. You have 3 kids, which you mentioned, and I think we mentioned earlier that you have 3 full-term pregnancies without any abortions. Is that correct?
Oh, yeah.
Or miscarriages?
No abortions or miscarriages.
Okay.
Correct.
Good. Any C-sections?
No, they're all vaginal births.
Okay. Good. What is your occupation? What do you do?
I'm a nurse practitioner.
Okay. Comes with a lot of stress. The normal amount of
No
stress.
more than any normal job.
Do you live in an apartment?
I live in a house.
You live in the house. Good. Do you have access to health care?
Yeah.
Do you have insurance?
Yeah.
Do you have access to grocery stores or the bus system or so
I
on
have
and so
a car.
forth? You have a car, so you have a means to get around.
Mm-hmm.
Good. What's your spiritual orientation? Are you Christian? Are you Buddhist? Are you
Christian.
Are you active in the church?
Yeah, I go like twice a week, and my kids do activities.
Okay, good. Your safetyness. How is your safety? Are you wearing your seatbelt?
Oh yeah, I wear my seatbelt and
Are you safety oriented? Like you?
I cross the street. I look both ways.
It's good. Do you have a pool at your house?
No.
Do you know what year your house was?
It's in the 80s.
Is it?
It's 1984. 86.
Okay, good. So no worries about lead paint or anything like that.
No.
Okay. Now what we're going to do is we're actually going to go over a review of your systems. You have 14 systems that we're going to go over. The first one being constitutional. Constitutional is more like, do you have any fevers, chills? Do you feel hot and cold all the time? Anything like that?
No.
No. What about ears, nose, or throat?
Fine.
Everything's fine. No drainage, no discharge, no swelling, no hoarseness.
No.
No. What's called dysphagia, difficulty swallowing. Aphasia, difficulty speaking, anything like that.
No.
No. Do you have any dental caries in your mouth?
No.
Good. Do you see a dentist on the regular? Do like a
I
6 month
should.
follow up? You should, but have you?
I'll probably see them once a year.
Okay, so but you do have one established.
Yeah, they know. They know where I am.
All right, good. What about cardiovascular issues? Has anyone ever told you that you have a heart murmur
No.
or an irregular heartbeat, like AFib?
No.
Any hypertension?
No.
Do
Just
you have
with pregnancy, my first one.
what happened with your pregnancy in your first one?
I had preeclampsia, but it was just related to my pregnancy.
Okay, did you get hospitalized for that?
I don't remember. They
You don't
gave me
remember?
magnesium. I think I just went to the ER.
So you went to the ER and got magnesium for it, and
Yeah.
they sent you home. Good. Um, do you have any respiratory issues like shortness of breath, COPD? Well, you said you weren't smoking, so probably not
No.
COPD. Any difficult breathing, sleep apnea?
No.
Any sputum production?
No.
Good. Do you have any problems with gastrointestinal? Do you have constipation, diarrhea, IBS?
No.
Nothing going on there. No pain. No irritation.
No.
No hemorrhoids.
Mm-mm.
Good. Gastro. Any problems with urinary issues,
No.
such as peeing, trouble making it to the bathroom,
No.
coughing and some coming out? You've had a pregnancy, so sometimes that
I mean,
occurs.
directly afterwards, that was no, but not now.
Good. You have good what's called caliber.
Kegels.
Your flow is going well. You've been doing Kegels.
Yes.
Good. Good. Um, um, moving forward, any problems besides the right thumb that we talked about earlier with
No.
musculoskeletal pain? So your shoulders are all good, your knees are good, your neck is okay, everything can move. It's what's called full range of
I'm
motion.
fine. It's just this thumb that bothers me.
Okay, good. We still gotta ask all the questions though. Anything wrong with your skin?
No. Oh, well, I have vitiligo.
You have
on my back.
vitiligo? How long have you had vitiligo
I was
for?
born with it.
Vitiligo.
I didn't even know I had it until my mom told me when I was like a teenager.
So you found out when you were 16 years old
I
or
don't
a
know, maybe
teenager?
like middle school.
Middle school, so like 13.
Whenever everyone found out Michael Jackson had it.
I have no idea what that was.
That was a long time ago.
Yeah, it sure
and me
was.
and my friends were talking about it, and then my mom was like, "You have it." I do? She said, "Yeah, it's all over your back." And I looked, and I'm like, "Oh."
So it's really not that severe then?
No.
Oh, okay. Doesn't cause you any problems then?
No.
You don't have any body self-image issues because of it?
I can't see it.
Fair enough. All right. Any cuts, scrapes, dry skin or something like that? Any
No.
eczema or something? No?
No.
All right. What about your breasts? Do you do self-breast exams?
Yes.
And, if you perform them, are you feeling anything different?
Everything's fine.
Everything's fine. Have you ever had a mammogram?
No.
No. Good. I still have to ask. Do you have any drainage or swelling or pain?
No.
No. Okay. Good. What about neurological? Meaning, do you have any headaches? Do you have any numbness going down your arms? Do you feel like you can't function correctly with your
No.
motors?
I mean, I have headaches like any normal person has headaches.
Okay. Good. What about psychiatric problems? Are you depressed? Do you have any anxiety? Do you have extra stress?
I don't think so. I have 3 kids under the age of 5. Other than that,
It's
I'm fine.
a little stressful. Do you have any, you are African American, so do you have any hematological disorders such as sickle cell disease?
No.
No. Okay. Any autoimmune diseases?
Just a vitiligo.
Just the vitiligo. Nothing like lupus or anything like that. What about, we already talked about your allergies and we saw what happened there. Okay. Then that comes to kind of the end here. We're going to do like a plan of care or your health risk assessment problems. So what we found out is through your family history, you do have cardiovascular disease in your history that your mom's father died at 40.
40-something.
40 something. So you're at risk for cardiovascular disease and where you don't exercise and being African American. Those are 3 big indicators of heart issues. Next is also at risk for diabetes. Even though you do, again, eat right, you don't exercise what you probably should be doing. And only that, again, your mom is obese and you have this family history of obesity, and you also have a family history of diabetes. So diabetes and obesity kind of run together. And the last thing, you are at risk for obesity because you don't exercise. So the key point is here is you need to, if you can, find time 30 to 60 minutes of moderate to vigorous exercise 3 to 5 times a week. I know that's difficult.
Yes, don't get fat.
Yes, don't get fat.
I won't.
And other than that, I also want to mention that with this right thumb pain, you should probably be taking some Tylenol or ibuprofen to help alleviate the pain. You said you're not doing that. And then I would apply something called RICE, which is rest, ice, compression, and elevation. Rest, don't use it if you don't have to, which you said you found out that you've gotten off social media, so that's a good start. Ice is 20 minutes off, not directly to the skin, but put something kind of in between, and 40 minutes, 20 minutes on, 40 minutes off, 2 to 3 times a day. Compression, we can get you kind of a wrist immobilizer or a thumb immobilizer to have you go home with if it's really bothering you that much. And then elevation, if you're sitting down, kind of keep it above or at heart level. And I believe that's pretty much it. I don't think you need to be referred anywhere. I think this can be managed by itself. If it does get a lot better, we can send you to orthopedics for it. I think that's a little extreme. And lastly, I think you're a fairly healthy person. You got a good health history going on. And I think you can come back for an annual checkup if need be. But outside of that, come back for the normal things if you get a fever over 100.4 or anything that you're concerned about. Please come back.
All right, great.
Do you have any questions?
No.
And that concludes our video. Thank you very much.